Hi there, this is Jason with Metropolitan Health Staffing Network. Just want to take a short couple of minutes to explain our hourly timesheet to those home health agencies that we help staff physical, occupational, and speech therapists with. And that also includes PTAs and or CODAs as well. Our home health timesheet is different from our hourly timesheet simply because most home health agencies pay on a per visit basis instead of an hourly basis, and we recognize that. And in most scenarios, you as the home health agency will be receiving this timesheet that is submitted from a therapist, from actually myself. The therapist will actually submit this, and most often their notes as well, to us, and then we submit those to the home health agency for one, submitting the timesheet for approval, and two, submitting the notes for the patient care. Upon receipt of the timesheet, this is what it should look like, and you'll receive one from each therapist. So if we have multiple therapists working with you as the home health agency, you'll be receiving multiple timesheets. There's one per therapist. So the therapist, I entered my name here, Jason Mulholland. They will print, they'll put their discipline over here, PT, OT, PTA, CODA, speech. And then the therapist has to sign it right here. And that is simply a checks and balances system, part of the checks and balances system, where they verify that their visits are complete. And our week ending date is always on a Saturday. So as I film this or record this on a Friday afternoon, the actual weekend date of the current week is Saturday, June the 8th of 2013. Now, in these lines here is where the therapist will record the actual patient name, the start and stop time of the visit, total hours they spent with the patient. And I always recommend, they don't necessarily have to, but I recommend that therapists record their mileage even if it's not part of the payment for the services that are rendered. And over here on the far right is where the therapist checks or X's in these boxes what type of visit it was. It could be a routine visit, it could be an OASIS start of care, OASIS evaluation, a discipline start of care, a discipline discharge. It could be a missed visit because there's documentation to complete for a missed visit and so forth. There's also areas here for therapists to write in what type of visit it may have been. So this is what it looks like when you, the home health agency, receives it, or it should look like this. Now, all that we ask you to do is verify that you have the documentation necessary for the patient care for the visits that are on this timesheet. And then you simply, and I'm going to do this in red, sign it here in the lower left. So, excuse me, your name may be John Doe, just for generality purposes, and then you will print your name here and then complete the information over here as well. Home health agency at your address, and then the city, state, and zip here. City in Missouri. And that's it. And when you're finished with that, all that we ask you do is, once you've signed it and approved it, just to simply fax it back to my eFax, which is 866-540-0837. Or if you prefer to do that via email, which we have some do via scan and email, you can also do that. And my email address is jason.mulholland, jason.mulholland at metrorph.com. And that is it. It's a simple checks and balances system that we require the therapist to sign and also the facility to sign, or the home health agency to sign, to verify that the visits have been completed. If you have any questions regarding this process, feel free to contact our office at 866-956-9246. Our hourly and or our home health timesheets are both due in the office on Mondays on a weekly basis by 12 noon. That allows us to enter in the information into our payroll system, which allows us to pay our therapist in a timely manner. Again, if you have any questions, feel free to contact myself. This is Jason with Metropolitan Health Staffing Network. Thank you.